Today, we are joined by Christine Nduta Kimani, a student at the Jomo, Kenyatta University of Agriculture and Technology in Kenya, as well as Yarwiwo Kitiyo from Women in GIS Kenya. Now, before we get started, I wanted to encourage you to enter any of your questions into the chat, and our speakers will be provided time to address them. So with that, I would like to introduce Yarwiwo Kitiyo, who is a leading specialist in GIS in Kenya and an expert in spatial data science with over 5 years experience in both implementing enterprise and capacity development. She's also a co-founder and lead strategist at Women in GIS Kenya and has been featured in the top 6 under 30 women breaking barriers in STEM by Mawazo Institute and the Einstein Forum for Application of Science, Technology, and Innovation for Socioeconomic Development. So thank you so much, Yarwiwo, for joining us today.
Thank you, Zan. Thank you, Zan, for that introduction. Hi, everyone. I'm really excited to be here today. I'm going to do a brief introduction about who Women in GIS is, and then I'll introduce Joy. So I'll just take like 5 minutes, and then I'll run it over to Joy. So a brief introduction. Women in GIS is a consortium of advocates. So we are made up of members from academia, government, private institutions, and our main aim is to embrace, empower, and inspire women within this space. So we drive and what we aim to do is provide an enabling environment, a good breed of mentors and women leaders, work on improving the self-confidence of young girls and women. And finally, we drive exposure and gender equity through our projects and data visualization challenges, which is actually why we are here today. So I'm really excited about this. So we do a couple of, we run on a couple of pillars. We have mentorship, meetups, capacity building, and very recently in 2018, we started doing projects and working with governments to address gender gaps across the country and across Africa. So that's just a screenshot of our community and the challenges we've had and the student seminars we've hosted. I think someone can spot Joy on one of those photos. I actually met Joy during one of our capacity building programs in university. So we've collaborated with university clubs across Kenya to just build capacity and build a vibrant community of spatial data scientists. So during the course of, so COVID hit us in last year in December, I think from December, November, and the impacts have escalated over that period. And one of the key things we were tasked with is we were part of a task force within the government where we were advising the Ministry of Health and the Ministry of Gender on how they can use data to understand the impacts of COVID across different dimensions. And one key thing that we have specialized in is having a gender dimension to every project that we do. And one of it is COVID and how we are building our gender situation room to address the gaps. So the gaps are diverse. We're looking at 4 dimensions: the health dimensions of COVID, economic empowerment. We split up FGM, and finally unpaid care work, because women are now at home, and how do we account for that? How are we able to measure that as part of GDP? So that's what brought us to the Teenage Pregnancy Visualization Challenge, which really came about when we had reports about an increase in the number of teenage pregnancies. Locally, school has been called out. So school has been cancelled until next year, until further notice actually. And one of the key things that were coming across media was an increase in teenage pregnancies across the country. So we decided, why not have a community-based challenge? We've had 3 challenges, and the main aim of our challenges is crowdsourcing insights and empowering our community to use and understand gender statistics. So by default, when you think about data, we talk about data in food security, we talk about data in transportation. So our main aim is to normalize using data in addressing gender gaps. And it's women and men addressing these gaps across the country. And we aim to do that using data and statistics that we get from government and from our crowdsourced data sets. So this is how Joy got into the challenge. We had an ongoing visualization challenge on teenage pregnancies and understanding the numbers and factors that lead to the surges in that number. Is it COVID? Is it because school is cancelled out? Is it social cultural barriers? Is it economic empowerment and women feeling like they need to sell out their bodies to get food or to get jobs, and in that process they get to get pregnant. And we're talking about 10 to 19-year-olds, and Joy will break down the numbers for us. We've previously ran cervical cancer challenges and a gender-based violence challenge as well, to just empower policymakers to understand what's happening across Kenya. So I'll do a brief background of Joy. So Joy is a student at the Jomo Kenyatta University, currently undertaking geomatic engineering. She has diverse skills in spatial analytics and visualization. And one of the key things she's passionate about is traveling and exploring the world through maps. And also what's really important, and I think it's a really good highlight, is she recently started doing software development, which was a 5-month course she attended. And I'm really excited for what she'll be able to pursue when you integrate software development, data, and analytics. So I'll hand it over to Joy. Yeah, everyone, this is Joy. And she's going to talk about teenage pregnancy across Kenya and the gender dimension to that and as an impact of COVID. Thank you. Joy, I'll hand it over back to you.
Wow, thank you, May. I feel like I don't need to do any other introduction. You've introduced me so well. So hi everyone, my name is Joy. And as May has told you, we took part in the challenge. I actually met May when I was learning to use this tool. She was the one who introduced me to Tableau, and I used it in this presentation. So let me just share my screen. Yeah, so this was my heading. I look at teenage pregnancies in Kenya, a gender dimension to COVID. What is causing these numbers? Are they actually rising or falling during these hard times? May has taken you through this. We have the causes of teenage pregnancies. Please note that these causes differ by county because of cultural beliefs. Okay, oh, sorry. And then we have the effects of teenage pregnancy. Of course, the body of a 10 to 19-year-old is not fully developed. So there are a lot of problems which are due to come about, like low weight birth babies and mental imbalance due to stress. This is your mind is not fully developed. And so this is something so unexpected in your life that you can't handle it, which will lead you to drug addiction. Not so many go back to school even after giving birth. So the education level tends to fall down. And then there's the stigmatization by the peers and society. Yeah, no one wants to associate with you. There's also exposure to diseases and STI, STD, because you don't fully know how to protect yourself. You don't know where to seek help. Sorry, I'll just, if you allow me, I'll just go to my presentation, whereby I'll show you what I did with the numbers. Yeah, so these are the pregnancy hotspots per county. This data is from DHLS2. They've been reporting and recording data since 2011 for Kenya, different types of data. So as you can see here, this is the 2016 quarter one, 2016 quarter one, when they started reporting. As you can see, the cases are very low compared to what we are seeing now for 2020 quarter two, when it's the last data this was recorded for the pregnancy. That was in June, I think. I've also created a filter such that we can view different years. Let's try towards 2017. Yeah, so as you can see, the numbers go rising up. There is nowhere they're dropping down. So this led, what are making these numbers rise up? And in which years? Is it the 10 to 14 age group or the 15 to 19. Please note that here, as you can see, the numbers are very low. This is per sub-county level data per point. It represents a sub-county. Please note that the numbers here, they're very low, but we cannot say the government has won. They are low due to the term teenage pregnancy to you might mean something different to them. As early as 10 years old, you can get married, so that's not teenage pregnancy. So that's why the reporting is very low. And also in some cases like rape and poverty, when you're raped, you're probably given to the aggressor, and the elders just talk about it, exchange a few gifts, and that's it. So the cases are not recorded. And it's evident here. This is the capital city, so the cases are very high in the capital city and also in the West. And then one variable that was in the data was family planning. So I did an analysis to show whether the family planning in 10 to 14 or 15 to 19, how it affects the pregnancy cases. For the 10 to 14-year-olds, family planning has always been high than the pregnancy cases, unlike the 15 to 19 shown down here. The cases for the 10 to 14 pregnancy cases, I think the highest was this in 2016 Q3, whereby it was 7,000. And also that's when the highest family planning use was used. Yeah, I think 14,000. Yeah. So it's whereby family planning is highly used, the pregnancy cases also fall. So I would have been interested in someone who's in Kenya. I wish we had someone else. Maybe May will take this question at the end, if she would agree whether her small sister or maybe any teenager she knows, will you tell them about this? Will you tell them that actually will you expose them to family planning when they're small as 10 to 14? And I would also love to hear how it's done in the US. Okay, for 15 to 19, the highest case was 104,000. And for the family planning, it's the blue line. It has always been lower, always lower. Actually, the only year it was the highest was last year, Q4, on which the cases dropped a bit. But as you can see, the family planning here also affects it. If it's very low, according to the previous number, the family planning of the next quarter are rising up. And so I compared the pregnancy to the population density of, So in this map shown here, I divided the pregnancy cases over the population, women population in that county. And on this map on the right, these are counties with the highest pregnancy. So I just added that data. So here, Nairobi County, our capital, is the highest with 109,000 cases. But when you divide those pregnancy cases with the population density, it's not actually that high, which can help us solve cases and know how to distribute our help. And the government agencies can actually know which counties to help first. As you can see here, Kisii County is the highest. So which means that the number of girls, teenagers who are pregnant in this area is actually very high compared to the population, which will lead to affect the education level. Yeah, and also as you can see in other counties, they do not appear as much highlighted. Let me just zoom this out. They don't appear as much highlighted in this according to the pregnancy cases, but according to the population density, when you add that factor, they're actually high. I would have loved to compare the pregnancy with many other cases like education level, but that maybe we can do that later. And then I broke it down to the worst affected county. So this is Nairobi County. There were actually two missing cases, two missing sub-counties. Here I created a time lapse. I created a time lapse whereby one can just view how the cases change per quarter. The inside of the county, the inner county, sub-counties, are the slums, are where the slums are found. And as you can see, the red tends to fall the red tends to fall in the inner counties. So yeah, when we break it down to sub-county level, one can actually view which sub-county to start with, and especially the slums, whereby you expect high poverty level, unreported rape cases, low level of education or even information among the women. So yeah, actually the most amazing thing about this challenge, we were to help other women who lost or didn't have a way during this COVID, who don't know, during this COVID time, people lost their jobs. We all know that. We had to dig deeper in our pockets. So the aim of this challenge was to ensure that we actually understand the problem. What solutions can we come up with during this time? Let me just, so yeah. The Ministry of Gender tasked the women in GIS to do this research, but they actually did it with the GBV, gender-based violence only. But so Yariwo and her team members and other team members from Women in GIS actually wanted to see, because the teenage pregnancies were being reported on TV, they actually wanted to see how they're being affected on other level, or is there any other factor that is being affected in any other level? So that's why they came up with a look at teenage pregnancies. And yes, we can say that during this time of COVID, the cases have actually risen. So there's need for alarm. The government needs to take course. I hope Yariwo, maybe the Ministry of Gender, we can get in touch with them and we can actually see what can be done. But it depends, as I said earlier, per area depends with the help given per county is different from another county because of the causes that I stated earlier, such as poverty levels. Poverty levels, we first need to define the per capita income per county and then decide which county or which sub-county needs help first. Like I said, in the North Rift, the causes are different. They vary according to the demographics. I remember Greg Babinski's presentation during the GIS Pro where he was talking about how a girl in the Sahel the challenges a girl in the Sahel faces before she gets what she requires versus someone living elsewhere in the first world country. So it's the same case in this case up here. The services are very poor. I don't know. I don't know what, sometimes the government doesn't take caution. The population is sparsely, the counties are sparsely populated. So, and the levels of education are very low. So for them to understand what actually teenage pregnancy means to them and its effects, the fact that you need to take a girl to school and not just marry her off, or that teenage pregnancy is okay, or that rape, oh, when you're raped, you can just be given away to the aggressor, and the elders talk about it over maybe a meal and it's done. So I think it needs to start from educating them that maybe it's time for a girl to go to school and not just get pregnant, just be a mom. Like, you also need to learn, you also need an education in this life. So I think it needs to start from that point. And also here in Nairobi, I couldn't, maybe Yario and I can talk about this later, but these cases in Nairobi, it's like, yes, it's among the smallest counties in Kenya, but it's the most populated and it's the highest cases, and it's considered the capital city. So the facilities are excellent. There are hospitals, but there are also high number of slums in this area. So we need to understand whether, is this a choice of the teenagers? Are the health facilities not affordable? Are the health facilities management or nurses not friendly? What the problem is? I actually feel that data lacks the emotional part, whereby you can actually interact with the victim and actually ask them, what went wrong? Like, please make me understand this. So yeah, that's one of the disadvantage of data. I would love to interact with the victim and actually know them. Like, how do you feel? Tell me more. So yeah, in the capital city, that's what maybe I love to do. In the Western region, as you can see, the cases are rising fast. This may be attributed to the high levels of poverty rising. And also in this Western region, the HIV cases are very high. So I think there's need for education in the West about diseases and about the teenagers. Because as you can see, within 4 years, the numbers, the red is really, really rising up. So maybe we can discuss this later with the various stakeholders involved in women in GIS and actually know what can be done about this, because that's a young age, 10 to 19. Some decisions once one makes, you might regret them for the rest of your life. So it's good one takes precaution and is actually educated on the various things that might lead them to a good future or a bad future. Yeah, and I think that's it. That concludes my presentation. Thanks.
Well, thank you so much. We've been listening to Joy Christine. She's a student of geomatic engineering. She's been showing data visualizations to help us understand more about teenage pregnancy cases in Kenya. And I just saw a comment come in over the chat from Kevin Mickey, our current URISA president, And he said that presentations like this one really help us all understand why the work we do and the technology solutions that we apply are so important to understanding and addressing challenges. And Joy Christine, I applaud your courage for talking about this, because Kevin, you're right. There are so many vastly important topics that are so sensitive that you can't go door to door to educate people about them or collect additional data. So Joy Christine, these data visualizations, you hit the nail on the head. You said something about ensuring that you understand the problem to be able to focus the solution. And I think data visualization is a brilliant way to approach such an interesting and impactful topic. I don't want to hog Joy Christine's time. I could talk to her forever. So please, if you have questions for Joy Christine, put them into the chat. We're a smaller group, so you could even unmute yourselves. I see a comment coming in from Isabella Mazzina. Are there ways to account for the cases that are not reported by the government? And what other reliable sources are used to gather this information?
Thank you so much, Isabella. In your first question, if there are ways to account for cases that are not reported, that's where you have to go door to door. Actually, these people are not educated. As I said earlier, the term teenage pregnancy to you and me means anyone from 10 to 19 years getting pregnant. But to them, that's not teenage pregnancy. There's nothing like that. You can just get married at the age of 10. So to account for these cases will be actually very hard. And then some people just tend to lock themselves up in the house, so you cannot know, and some people tend to give birth at home. Also, this data is collected at hospital level. So if there are no medical facilities where you live, I don't think there's any way of getting this data. And also other reliable sources. It's in conjunction with Ministry of Health and the DHLS2, which has been in Kenya since 2011. I hope that answers your question, Isabella.
And if it doesn't, please follow up with a clarifying question and we'll be sure to ask it for you. The next question comes from Kim McDonough. He asks, so now that the maps show regional differences, will education programs have to be adapted for cultural differences across the country?
Thank you, Kim. Okay, so it's actually difficult to educate some people who don't have any literacy level from reading and writing about what is right and what is wrong. So this can actually be done for young kids who are coming up. Schools can be set up so that the youth can actually learn what this means and how teenage pregnancy will affect their future. Even when they're male, even when they're male, these are their sisters and cousins. Yeah, I'm very sure they'll want to see them succeed. So I think, and also setting up educational programs, that would have to be in conjunction with the Ministry of Gender, Ministry of Education. So I don't think that's in our power. We'll just present this to them and tell them this is what we have. Can you consider this? But I think the education should be set up from when someone is little, because it's very hard to teach an old dog new tricks. I hope that answers your question, Kim.
Please be sure
to add on to that.
Answering your questions.
Let me just add on to what Joy has mentioned on Kim's question. So one of the key roles that one of the key ways that the Ministry of Gender is trying to address gender gaps is now adoption of technology and using data to address these challenges. And one of the things we are highlighting is how to build local response mechanisms across gender issues, because all these issues are different and they're cross-dimensional. So if, for example, what Joy is saying, like teenage pregnancy, in one county it's due to cultural barriers. In Nairobi, it's due to financial constraints. In another county, it's due to something else, right? And that really just speaks to the magnitude of the issues that we are facing and how important location information is in addressing issues that affect women and girls. Like, it has never been so important for us to capture location information than when it comes to gender issues. Like, it's really important so that governments and policymakers can build local response mechanism. So a seminar that will take place in Nairobi and the issues that they'll address is not the same awareness campaign that the Ministry of Gender would run in a county like Turkana, right? Because the education levels are different, the challenges they're facing are different, they look at pregnancy differently. So yes, the solution is actually localizing and customizing response mechanisms at county level and even at a lower level, at like village level, for communities to understand what this means, and yeah, to just bring that down. And also maybe to add on the other question on, are there other reliable sources of data? So yes, the data does not just come from government. There's communities of practice. There's NGOs that are in direct contact with victims or with families. So this data is also integrated and pushed into the system, into the Ministry of Gender dataset for them to understand and integrate the sources. So there's other sources. There's data from NGOs, the data from community of practices like church or a grassroots community that's dealing directly with these women. And then now all this can be integrated in addition to what government collects at hospitals and at chief level or at chief camps and then at the different refugee camps. So all this is integrated to come into the system, to come into the DHS system.
Yeah, thank you very well.
You mentioned, Joy Christine, you demonstrated it for us, the time-lapse slider on your Tableau, and I thought that was a very impactful way. And you say that, you know, collecting more data, especially all the way down to the village level, is going to be very important. And I think that will be a nice way of displaying that data to be able to establish any trends that can then be noticed to see if the educational offerings are having an effect. So again, I thought that time-lapse slider was a very impactful way of showing your data visualization. And we had another question come in saying, do the dots on your map have values associated with them?
Yeah, oh yes, oh, I've just quit that. Sure. So these dots are the sub-county, they represent sub-county. Like, as you can see here, that is Turkana sub-county with 171. I apologize, I couldn't get it to show the boundaries correctly, but yeah, the dot means, it means the sub-county. It represents the sub-county, sorry.
Fantastic. Oh yeah. I believe your Tableau is publicly available. If you'd be willing to share that link in the chat, I think a lot of us would be really interested in digging through the visualizations you've compiled so far.
Yes, I'll share it. Can I share it right here or in the URISA platform?
That would get you even more a broader audience. I think that's a great place to put it into URISA Connect.
Okay, I'll put it there. So yeah, I actually have a question to you guys. On the education of family planning, how is it in the US? I'm interested. Because
yeah, I'll defer to see if we have any public health experts on the line. That's not my area of expertise, but if I don't see Bernadette's usually the person I reference those kind of questions to, but would any of the attendees like to address how you visualize or how you feel family planning is undertaken in the US? Let's give people a moment to respond in the chat, or feel free to unmute yourselves.
No, also Zan, like, is it something that you would want your child to take? Like, will you tell them like it's okay, like family planning is okay as early as 10 years old?
I think I personally, speaking from my personal perspective, I would think it depends on your family values and how you want to approach family planning within your familial unit. For me personally, my mom started as early as I remember being able to comprehend pictures. I'm the youngest of 5, and she had an anatomy book that I remember, goodness, being either 3 or 4 at the age I was, and her going through a baby in the womb and the development and the gestational periods and how they were conceived and things like that. My mom was very scientific. She was very open. again, she had 5 children, so family planning was something that, you know, she had to do herself. So she was very open for my family experience. But again, I think it will just depend on each family unit and how they want to approach it. But I certainly felt like it was, planning materials were always available to me. I remember going to the pediatrician's office, and I don't know if it was my specific pediatrician or all pediatricians across the country, but they had the little anatomy set where, you know, the baby would pop out of the mother and things like that. Again, it was just this plastic mold set, but it let us kind of get familiar with the idea of anatomy. Again, my mom may have chosen this pediatrician for that exact reason, because she had this scientific view of things. But it was very eye-opening to me and made it very different. And we talked early on about family planning. So that's my personal experience. If I don't want to put anybody on the spot if they're uncomfortable talking about it, but I'd love to hear from others if they would be willing to share their own experience.
Okay.
This is Kim McDonough. Speaking from having a grown daughter, I think overall family planning is fairly fragmented in the US. There's not a consistent program nationally. It varies from one, almost the same as what you may be talking about from county to county. Culturally, I think there's been a trend towards women having babies later, and I think that's a combination of education. Laws have been passed. The legal age for a woman to enter marriage by her own decision has gradually gone up through the years. I think originally it may have been as young as 14. I think it's now 16 in some places, 18 in probably the majority. My daughter did participate in a, for them, it was a teenage peer counseling group that they dealt quite a bit with sex education and family planning. And it was very impactful from having teenagers counsel other teenagers on that. But again, like our local government and particularly our state government does not have a consistent program that would discourage or to encourage later families. And I think it's more of a cultural norm than certainly, again, some laws have been passed. They've seen that it was an advantage to the society for women to become mothers later in life. So there's still, we have our share of controversies, but I think it's probably a bit different than what I know it's a bit different than what you're experiencing there in Kenya. But I think you'll probably find the same thing as over time that the debate will evolve. But again, we don't have a consistent program across the country.
Well, thank you for that insight, Kim. Megan also said most American children take some sort of health class in public education around the age of 11 to 13 that covers some topics of family planning. And Megan, you're right. I remember that class. I remember in health class talking about family planning, and I couldn't remember the age, but I do remember that the topics weren't new to me. So again, good point, Megan, and thank you, Kim, for sharing those insights, especially having having a daughter. That's a good first-person experience.
Yeah, so I don't think Yariwo and I had that class. Yariwo, did you?
Actually, no,
I
don't think we had that.
It's not talked about. It's sort of a taboo, depending on how your parents perceive it. So it's kind of a taboo. So no one really talks about it like a health class in public education. And age 11, I don't think, I've never had, maybe in international schools, but the schools we went to, we didn't experience that. Yeah, so Yariwo, I'll put you in the spot and then I'll ask you, as you can see here in Kenya, the teenage pregnancies is working. So would you advise any teenager to seek this as an option, because it actually comes to your family choices and values and what you believe in?
That's a tricky question. Because I don't know. I think when government was trying to address the current crisis that we have on teenage pregnancies, and one of the key things that came up was restructuring our education system and just ensuring that kids are exposed to family planning and are exposed to, all this biological stuff that they need to know at a lower level, based on the trends that we are seeing on kids dropping out of school because of pregnancy. Or so government has said that they're planning to change the curriculum, and I think they have actually changed that. So I think that's a good way of addressing it, integrating it in the education system at an early age, which is what they're doing now. They've gotten rid of the education system Joy and I went through. So we went through a system called 844. Now they're doing a totally different system, which would take care of these gaps that we didn't have knowledge on, like family planning and all that. So I think, basically, I think that would be a good way, like exposing them to it as soon as early as possible. Because now, when I think the other reason why we have such huge numbers is, again, lack of education, right? Like this might be kids who are in school, but they don't really know the repercussions. They don't know what would happen. So I think exposing them would actually help us see the numbers. It would be interesting to look at, the numbers when after this curriculum actually kicks off next year, and the teenage pregnancies as well, and just seeing the comparison.
No, that's a good point, Yariwo. And Megan agreed that, sometimes it just depends on the curriculum. Kim made a point that health is a regular class here in the US, but depending on the school system, family planning may not be a deliberate part of that curriculum. But Kim did make the observation that your data that you're showing here appears to show a downward trend in adolescent pregnancies when education programs are increased. So is that what's the impetus behind increasing these education programs further, is that the trend seems to be showing that it's an impactful way to educate people?
Thank you, Kim. I actually didn't add any educational data. Would you mind showing me the slide, or telling me which slide, so that I can go back to it and explain?
Actually, it's the one you're showing right now, where it's pregnancy versus family planning. When you say family planning, I guess I'm making the assumption that includes a degree of education associated with it. Like in 2019, in March, you show a spike in family planning. Is that an educational program, or is that education combined with just making it more available?
Okay, the spike may be caused by various covariates. Also, some parents might just force you to take the family planning as an option in order to avoid you getting pregnant again. So it might, and also the government rolls up this budget increase in family planning, but they don't come out clear. I mean, you might hear them about 3 months or 4 months later, according to from when it occurred. So really, this might be caused by so many covariates. Like it might be education, like what you said. Many people got exposed to it. It might be forced. It might be a budget increase in the sector by the government. Oh, and also, are girls encouraged to remain in school to a certain age? No, girls are actually after pregnancy. Oh, that also depends on the family.
In general, are girls encouraged or pushed to remain in school, period, pregnant or not? We work with a program in Uganda, and they're finding that the longer a girl stays in school, the lower the chances are that she will have an adolescent pregnancy.
Yes, that's true. We are encouraged to go back to school. Actually, May went back to school. She's doing her master's. So yeah, generally girls are encouraged to go back to school. They are working for their PhD, their masters. I think May will go for her PhD next. So yeah, generally there is an upward trend of showing that girls can really make it in the career sector. You can be anything. So yeah, I don't know about Uganda, but here in Kenya, there is an upward trend of girls remaining in school.
You mentioned the need for education time and time again. I've heard that. So knowing that this webinar is being recorded and it will be available to you if you'd like to share it with teenagers in Kenya, is there any resources, are there any messages that you'd like to share with your fellow residents?
Yes, I'll tell you to stay in school. Please don't get pregnant while in school. I had a fantastic teenagehood. I had a fantastic teenagehood concentrating on my books. Please stay in school, learn. There are rewards out here. University is awesome. You get to meet so many people who you interact with. So yeah, please stay in school and also research on the effects of this. You might not know the effects of teenage pregnancy right now. Yeah, but afterwards, there are so many effects of teenage pregnancy. You will not go back to school. You might fall ill, drug abuse and substances. So yeah.
That's
and also if you are an adult in Kenya, yeah, please comment and tell me whether you would actually want to see your teenager learning about family planning or using it. I'd love to hear that.
And is there a way they could contact you if they watch this video? Is there an email address or anything like that where you would like them to reach out to you?
Oh yeah, can we add that after the video in the comment section? Yeah, thank you.
And your WeWo, anything additionally, the idea was what we thought was a great idea that Megan and Siobhan had, we'll have the live webinar and this recording will be made available, is the idea that if you can't necessarily, talk to people with the pandemic in person or approach the subject because it's so sensitive, this video may serve to educate some of the teenagers, especially how to work with spatial data, which we thought was a great way of outreach of GIS and geospatial applications. So I wondered if you had any messages that you'd like to include.
Pardon, please, pardon.
Certainly, I just wondered if there was, knowing that this is being recorded, if you had teenagers in Kenya that get to see this recording from the privacy and safety of their own home, if there was a message that you'd really like to send out to them.
I don't know if you guys can. Okay. I think I'd say, yeah, like Joy said, stay in school, but also if you happen to be if you happen to get pregnant at teenagehood, that's not the end of it, right? People always bounce back. Yeah, and you can always get back to school and get back to, yeah, to just being a teenager even after pregnancy. Pregnancy is not the end of it. And yeah, try and also just, yeah, improve your skills, basically. Be the best version of yourself, regardless of whether you got pregnant or whether you're working towards that. Just try and be the best version of yourself across any space, tech, data, policy. Yeah, just go for it.
Yeah, Yariwa, is there a hotline where one can call?
For teenage pregnancy?
Yeah.
No, there's a hotline for gender-based violence and for child. Okay. And for child abuse, I don't think there's one for, no, we don't, there's no, the ministry hasn't set one up for teen pregnancy. But
okay, we'll see what
gender-based violence, actually.
Okay.
And Joy, Christine, I wondered if you'd share with us what the most inspiring part of your work using Tableau to create these data visualizations was. Did you have an aha moment? Was there a certain widget or any kind of certain tool that you ended up using or plugging in or enabling that really helped you feel like you were making a very visual an impact, that would really help give your message?
Okay. First, Tableau is free, so there are online tutorials on how to do your analysis, how to add maps, but actually to visualize, because I was just given raw data and then I had to decide what I will do with it. So, I actually wanted to view it in a teenager's perspective. If I was a teenager, what would I want to see? I wanted to simplify it to the lowest level so that anyone as early as 10 years old can understand what I'm talking about. Some roadblocks, yeah, my laptop is really slow. So I actually took long to do this, actually put in a lot of hours. And I'll actually encourage anyone to use Tableau. It has amazing features. I haven't explored them, all of them. So yeah.
That sounds good. Thank you for sharing that. Again, I appreciate you tailoring the message so it would be digestible and understandable to as early as 10-year-old, because oftentimes we find ourselves in a industry full of jargon and it may be difficult for them to be able to comprehend what message you're trying to provide. So that was a really smart approach. I see that Wendy Nelson asked, what other important projects are you working on right now?
Well, I am actually working on another competition. So I won't spill the beans now.
That's fair. We hope to hear about it at some point.
Yes. I hope so too. So I'm actually working. I'm almost through, but I hope I will win this one. Yeah.
Well, we are so grateful that you chose to participate in the student competition, because I certainly have learned a lot, and you've opened my eyes to a way to address, again, a very important and sensitive subject with GIS. Oftentimes it's very physical data that I'm working with, and this is a new aspect that I have now been educated on, and I appreciate that very much. Are there any last minute questions for Joy Christine? We have about 5 minutes left. It's been a true pleasure having you join us today. So any last minute comments from you while people type in their last thoughts into the chat?
Nope.
Okay, and Yarwiwo, anything before we close out the hour?
Yeah, thank you so much for coming. Thank you for making time out of your busy schedule. Yeah, thank you so much for supporting me. Well,
again, I wanted to thank Joy Christine for joining us today, because I'm a firm believer that sharing research and data visualization is such important work. And I wanted to thank Yarwiwo for joining us and providing good insight into women in GIS Kenya and your activities, even while limited by the pandemic. And I'm with you, Yarwiwo. I want to thank our attendees, because supporting our geospatial students is so important, and they're our student members. So I'm excited to see where this research will take them. So stay tuned for the URISA 2021 calendar of events. It will be posted online when the schedule solidifies. And this will also include the next student webinar series. I think that's slated for later January or February. We're going to have a few more of these throughout the year. It's a very exciting way. And Kim, I could not ditto or restate your comment enough. Thank you both to our presenters for staying up so late to present to us today. We know the time difference is great, and we very much value your time. So I just wanted to say one more time, thank you all so much for joining us today, and be well.